Go, action.
All right, so first of all, I'd like to thank all of you for having us here and giving us some of your time. We are the fourth semester full-time students. My name's Luis.
I'm Geneva.
Noemi.
Janine.
And we have a quality improvement project that we have looked over, and we've thought maybe this could help this unit out a little. So first of all, I'd like to ask all of you a couple questions. It's just something similar. You don't have to raise your hands or anything if you don't like. So first off, I'd like to ask, how many of you have ever had a situation where you may have forgotten a flush, or maybe an alcohol prep pad, or maybe even some gauze? See? Okay, so it happens, right? It happens. Sometimes it happens. And following up with that question, how many of you have believe that these avoidable circumstances could have been prevented and could have helped better provide patient care to all your patients on a daily basis? Mm-hmm. Right? Okay, so that's good. And then lastly, do any of you feel that if these interruptions were minimized and you had more time on your hands, that you could perhaps provide more attention and care to your patients and better manage all your assignments on a daily basis?
Most definitely.
Okay, so definitely that's some things that we were kind of looking at. So for our quality improvement project, we have created a small little tool that's accessible pretty much on every unit. And it perhaps might even revolutionize your unit. But in all honesty, we hope that this definitely will help improve it just a tiny bit, because we all know that you are very hardworking individuals. Yes. And you're all great, of course. I know. And we all appreciate it, of course. But of course, we sometimes forget things, and it's totally normal, right? Mm-hmm. So for that reason, we have created this little project for you. It's called Just In Case.
Yes.
It's a little cup with all your basic essential needs that you may need in case of forgetting a certain piece of supply.
All right, so of course, before we came up with the project, we want to make sure that it was backed up by evidence. So we took the time to do a literature review. So we're just going to read over really briefly regards to the articles that we read regarding our project. So for one of mine, time management is very crucial to the nurses and helps them to plan for their available time and use it to manage their tasks.
Another study that we found is that good time management skills and techniques are essential for to function more and to focus on results. And another one is, as a nurse, we give medication to one patient an average of 15 minutes. But most likely we have at least 4 patients, so we need 60 to 90 minutes to finish that intervention. So if we have any delay in preparing it, administering it, or even locating the supply, it'll actually add up to the time needed to do that intervention.
That's true. And then for the study that I looked into, it focused in on the new graduate nurses and then the kind of help that they need. Like, they have a lot of struggle in that 1 year, so the study looked into what those could be and how we can help them.
And my gigantic paragraph that I have there, or story that you want to see there, to just summarize it, it was just an article based that having supplies at the ready and being able to access them much faster can definitely improve in reducing interruptions, reducing risk of making a mistake, and the need to have your supplies ready at hand. And now following up with, after the reviews that we have a who, what, when, where we explain as to why the cup is useful for the unit. So starting with who.
Okay, who. So the Just In Case cup is actually designed to be utilized primarily by nurses and other medical staff that are in lack in supply when facing emergency situation. Additionally, it is beneficial if the medical staff wanted to improve their time management skills to lessen the patient care interruptions. And if you ever use any of the supply from the cup, please don't forget to respond. Thank you.
Alright guys, so what is the Just In Case cup? So Just In Case is an emergency kit that includes supplies that all medical staff can use. So it includes supplies that are commonly used and or forgotten once in a patient's room. So we made it with the intent that you've already grabbed your supplies, but let's say you happen to forget that alcohol prep pad, that saline flush that you needed. And so as a group, we identified the common items that most nurses need when they need to complete providers' orders, daily routine tasks, which will ultimately lessen the amount of time that you need to grab those items. So just like a brief intro onto what we included. So we have red dot electrodes, suture removal kit with scissors in there, saline flushes, you definitely need those, marker, those caps, door lock caps, tape, pen, plenty of alcohol prep pads, the tags for your IV tubing, Tegaderm, gauze, and the Identihide. Yeah, it's 14 items, and then plus the triangular cylinder for input and output that encloses the whole thing.
Exactly, and also we like to sometimes incorporate some scissors because we know sometimes we can forget the scissors, and we need those to cut all kinds of things. So following up with the with when.
That's right.
That's you.
So when can we use it just in case cup? Well, scenario one, think of, you all are very experienced nurses and very capable nurses, but we're all human and we forget sometimes. So just those day-to-day moments is when it's really useful. Like, I forgot my alcohol swab, or I can't even write the patient's family member's phone number because I forgot my pen. So for that. And then another time we could use it is like in the board, emergency situations. We don't have time to be scrambling for that saline flush. We need it right then and there. So that's really useful for that. It's already in the patient room. And then another situation that we thought of is for us like baby nurses, the new graduates. We're still like figuring out how to manage our time and how to do things in the most efficient way. And so having that support there to worry less about like, oh man, I already forgot this and that. We're still trying to learn, so that will be really helpful for us too.
That's right.
Okay, where do we put it? So each patient's room will have the just-in-case cup located inside the locked cabinet on top of the computers. This location is actually secured and easy to be accessed by nurses and medical staff.
Okay, and of course as to why, we've already explained that the main reasons is to be able to reduce the interruptions, to help increase time management and more efficiency with our ability to provide better patient care. But again, you guys are all phenomenal, and we all know that you guys provide excellent care, but sometimes being able to dedicate all our time into our patients is perhaps one of those important things that we need to do. So our goal is pretty much for this cup to help all of you on this unit, and all the other units of course as well, to help improve on that. Lastly, for our conclusion, we all know that change is something that is not easy to do, especially on a unit when everyone's used to their certain customs. We know that, but however, it's always easier to it's always good to make things easier on ourselves in order to make things better. Since we have a lot of things, a lot of assignments that we have to do, and making it easier on ourselves definitely is a good thing. Especially for us new grads, as one of my classmates mentioned, when we come in, the biggest thing that we're going to be facing is the ability to time manage, which is something that is a skill that takes a long time to really master. So we're hoping that with a tool like this, it'll help us on the long run to be able to manage better our new career experiences here, if we were to work here or anywhere else. So as one of those famous sayings goes, we like to work smarter, not harder. Right? And pretty much that is it. Thank you all very much.
Thank you.
Do you guys have questions?
Who puts these kits together? Should we put them together when we're getting a new patient?
So that's an excellent question, and yes, what we were thinking is it's kind of like a trust system between nurses. So one nurse, would create the cup in the morning for use of themselves. Of course, they would replace them, and then the night shift would do the same thing. So they would use the cup, they replace everything, and we know that we're going to be going in and out of patients' rooms all the time, right? So as soon as you realize that, okay, I've used a piece of equipment from this cup, all right, the next time I go to see that patient, I will just quickly grab something from the supply room and just replace it right off the bat. And that way the next nurse will be able to just, oh, okay, I got the supplies, and they will do the same thing.
So just like a buddy system, just make sure that if you take one out, replace it.
Absolutely. So it's a trust system, buddy system, and we know that, you know, the list of supplies doesn't have to be exactly, you know, but it's just enough supplies that you think you might need for during the day. And it's only meant to be used as an emergency situation, you know, where you need a flush or you need an alcohol prep pad, and you can't, you know, that way you don't have to walk out of the room, have the increased risk of making, you know, med error, you know, or forgetting to flush something, you know. So it's really just to have a, you know, just in case. You know? So as the name suggests, you know, it's just to kind of help improve with that reduction of having to leave and waste time. And that's it. Any other questions that we can answer for you?
Excellent.